is start with the metabolic response to injury. Okay, so this is first chapter of 28th edition of Bailey. We'll cover it in part wise. Okay, so in introduction, nothing important. So the first is homeostasis. So metabolic response of injury divided into two parts. First part is catabolism and the next part is anabolism. So initial part is catabolism, okay, and the catabolism include the shock, okay, followed by anabolic phase that include repair and tissue healing, okay. So in catabolic phase, everything is decreased like hypovolemia, okay, decrease BMR, okay, reduce cardiac output, hypothermia and lactic acidosis, okay. So in this phase, body try to conserve both volume and energy store, okay. So remember, volume and energy store being conserved, okay. So next is so what is the catabolic effect on the body? So muscle breakdown, weight loss and hyperglycemia. So so remember, only thing is increases hyperglycemia, hyper not hypo, okay. So this is important, okay. And with this increase risk of sepsis, okay. So this increase risk of sepsis, and anabolic phase also known as rebuilding phase, okay. So in modern surgical care, nothing much important, just MODS, the multiple organ dysfunction syndrome associated with 25% of mortality rate, but this percentage varies, okay. You will see in subsequent video, okay. So this picture sometimes ask, so they will ask what is this graph, okay. So this curve is major trauma, next is minor trauma and starvation related to resting metabolic rate. So in starvation it is goes below the baseline, okay. This is normal range, okay. So what is the magnitude of injury response, okay. So magnitude response of injury is graded, that is very important, okay. So more severe the injury, greater the response, okay. So it's graded, the keyword is graded, okay. And the genetic plays important role in determining the intensity of the inflammatory response. So genetic has got a key role in the response in injury, okay. So next topic is mediators of metabolic response to injury, okay. I have separate short video on this, you can watch, okay. So this is there is a word called damage associated molecular pattern, DAMP or alarmin. So this alarmin is a part of innate immune system of the body, okay, which include macrophage, neutrophil and dendritic cell, okay. And with this they form the intracellular protein known as inflammasome, okay. So remember, in is intracellular, okay. So this they ask, okay. So inflammasome is intracellular, okay. Next is there are different types of DAMPs. This is very favorite question of NEET PG, NEET SS. This time it was also asked also, okay. So DAMPs include heat shock protein, okay, high mobility group protein B, HMGB1, okay, S100 protein and fragments of nucleic acid, okay. So this is very important, okay. And the last part of this, the some secondary trigger of the metabolic response to injury, okay. So secondary trigger of inflammatory pathway in trauma and surgery is sepsis, hemorrhage, massive transfusion, acidosis, surgery and crush syndrome and ischemia reperfusion, okay. So amplify or prolong the catabolic phase leading to organ failure or immune dysfunction. So it is part of catabolic phase, okay. So this is important, okay. We'll see you in the next part 2, okay.